बात करेंगे आज रोमेटॉइड आर्थराइटिस पे। रोमेटॉइड आर्थराइटिस एक ऑटोइम्यून डिसऑर्डर है जिसमें स्मॉल जॉइंट्स को इन्वॉल्व करता है और स्मॉल जॉइंट्स में भी मेटाकार्पोफिलेंजियल जॉइंट और प्रॉक्सिमल इंटरफिलेंजियल जॉइंट्स को इन्वॉल्व करता है, और ये ऑपोजिट है ऑस्टियोआर्थराइटिस के, विच इज़ इन्वॉल्विंग द डिस्टल इंटरफिलेंजियल जॉइंट्स। ठीक हो गया। अच्छा, अब ये एक जॉइंट मैंने बनाया है जिस जॉइंट के अंदर साइनोवियल मेम्ब्रेन है, दो बोन्स हैं और उनके दरमियान कार्टिलेज पड़ा हुआ है। सो व्हाट इज़ हैपनिंग, तीन चीज़ें आर बड़ी इंपॉर्टेंट, थ्री थिंग्स आर वेरी इंपॉर्टेंट फॉर द पैथोजेनेसिस ऑफ द रूमेटॉइड आर्थराइटिस टू अंडरस्टैंड। फर्स्ट, it is occurring in those individuals in which the histocompatible genes which are actually making major histocompatible receptors, ये क्या हैं, ये वो receptors होते हैं जो recognize करते हैं antigens को, and these receptors are present on the एंटीजन प्रेजेंटिंग सेल्स। ये जो रिसेप्टर्स हैं जिनको हम मेजर हिस्टोकम्पैटिबल रिसेप्टर्स कहते हैं, दे आर मेड बाय HLA जीन। In patients of rheumatoid arthritis, these HLA genes are actually HLA-DR4. HLA-DR4. So they make those major histocompatible receptors that are involved in the pathogenesis of rheumatoid arthritis. दूसरा पॉइंट, स्मोकिंग या इन्फेक्शन की वजह से नॉर्मल प्रोटीन्स विच आर कॉल्ड सेल प्रोटीन्स आर चेंज एंड दे आर कॉल्ड citrulinated proteins. So those patients who have rheumatoid arthritis, they have citrulated proteins in the body. Number two. Number three is that in the thymus, the T lymphocytes which are destructive, they enter into the blood. These are called self-reactive T lymphocytes, and this process is called loss of immune tolerance. So these three mechanisms are working together hand in hand in the pathogenesis of rheumatoid arthritis. For example, an antigen presenting cell with a typical receptor of made by HLA-DR4, when is present in the circulation, associated with is encountered or is exposed to that antigen which is already changed and is called CCP protein because of smoking or infection. This antigen presenting cell will take this antigen as a foreign antigen and it will engulf it, and after processing it, the finest particle of this citrulated protein is going to attach to this receptor which is called major histocompatible receptor. Now the third thing is self-reactive T lymphocytes. Now these self-reactive T lymphocytes, antigen presenting cell will present this citrulated protein to the self-reactive or the destructive T lymphocytes. So what will it do? It will activate the TH1, TH17 and it all ask B cells which are normally responsible for the production of the antibodies. So TH1 helper T cell and TH17, they will invite the infiltratory cells to the joint, and they will also ask synovial cells, which are synovial cells which are actually lining the synovial membrane. So these synovial cells will secrete protease enzyme which will call degradation of the cartilage. Apart from that, B cells are going to make antibodies. Now there are two types of antibodies. One is the antibodies which are made because of the antigen which is presented to them, which is called CCP. So these antibodies are called anti-CCP antibodies. Second antibodies are called RA factor. What are RA factor? That in our whole body, most common immunoglobulins which are present in our body are called IgG. So what will happen, that B cells will produce those antibodies that are formed against these antibodies. These are called auto antibodies, and in other words we call them as clinically as RA factor. So if somebody is going to ask you which is most common, anti-CCP or RA factor, when it comes to the specificity of disease, your answer will be anti-CCP, because these are the antibodies which are related to the pathogenesis of rheumatoid arthritis, whereas RA factor may be present, may not be present in rheumatoid arthritis, and RA factor can be present in any autoimmune disease, whether it is RA, whether it is SLE, any autoimmune disease. So it is not specific to the rheumatoid arthritis, which is the only specific antibody is anti-CCP. Last but not least, the deformities are small neck deformity. What is small neck deformity? That the finger, the upper proximal part, it is going to be flexed like a neck of a small swan. So it is called swan neck deformity, and the wrists are deviated. So it is going to deviate towards the ulnar side, and that is called the wrist deviation. And apart from that, since it is an autoimmune disorder, so antigen antibody complexes are just like the pellets of the gun bullet, and they are going to deposit in the lung, they are going to deposit in the skin, they are going to deposit in the heart, in the pleura, and even in the orbit. In the orbit, it will cause keratoconjunctivitis. So this is basically the pathogenesis. And what will happen, that the synovial membrane will have lymphocytic infiltrate, which is present over there, and the synovial cells are also proliferated. So the proliferation of the synovial membrane along with the lymphocyte, we call them as a Panus formation. What is that called? This is basically called the Panus formation. Let me write it for you. This is called Panus formation. So this Panus is also going to destroy the cartilage, and in the last, what will happen, that in the last is this, that the joint is going to fuse together. So fusion of the joint, which is called fibrosing and ankylosis. What is that called? Fibrosing and ankylosis is formed in the rheumatoid arthritis. Remember one thing, the morning stiffness of the rheumatoid arthritis is more than 30 minutes, whereas it's around 30 minutes in osteoarthritis. That's all about it. Thank you.